Good morning, everyone. My name is Wilson Chung. My matrix number is BM25110074. Today, I would like to present about the structure, function, and clinical importance of the lung. Let me introduce to you about the lung. The lung are the main organ of the respiratory system and are essential for sustaining life. Their Their primary role is gas exchange, where oxygen from inhaled air enters the bloodstream while carbon dioxide, which is a metabolic waste product, is removed from the body. Oxygen is necessary for aerobic respiration in cells, which produce energy in the form of ATP, while carbon dioxide must be eliminated to prevent acid-base imbalance. In addition to gaseous exchange, the lung play an important role in maintaining the blood pH by regulating the carbon dioxide level. They work closely with the heart through the pulmonary circulation to ensure the efficient transport of respiratory gases between the lung and the body tissue. Due to their constant exposure to the external environment, the lungs are vulnerable to infection, pollutant, and chronic disease such as tuberculosis, TB, asthma, and other chronic obstructive pulmonary disease. Therefore, understanding lung structure and function is clinically important for disease prevention, diagnosis, and management. For the next one, we are gonna talking about the anatomy of the lung. The lung are a pair, soft and which pair is mean they got the two lung, soft and elastic organ located on either side of the mediastum with the thoracic cavity. Mediastum is um is the space between the two lung which got the vital structure such as the heart, the helium content, and the branches lah. Although they appear similar, the right and left lung is slightly got difference anatomically. The right lung is larger. The right lung is larger and divided into three lobes, which is superior, middle, and inferior, by the oblique and horizontal fissure. It is a line lah. In contrast, the left lung has only two lobes, which is the superior and inferior, and contain a cardiac notch to accommodate the position of the heart. Okay, you can see here they got the cardiac notch is near the position of the heart lah. Each lung is enclosed by a double layer serous membrane called the pleura. The pleura got separated into two layers, which is visceral and parietal. Visceral is the internal one, and the parietal is the external one. And between them got a cavity called pleural cavity. Okay, okay, and the cavity got a pleural fluid to reduce the friction during the breathing. On the on the medial surface of each lung got what? Got the helium. Helium is a region where the main branches, pulmonary artery, vein, lymphatic vessel, and nerve enter and leave the lung. This organized anatomically structure ensure the efficient airflow, blood supply, and neural control required for respiration. Okay, now let's talk about the structure inside the lung. The small structure lah is alveoli. Alveoli is a microscopic, thin-walled air sac located at the end of the respiratory bronchioles and serve as the functional unit of the lung, which is the place that gases exchange occur. Each lung contains approximately 300 million alveoli, creating a very large surface area that allows efficient gases exchange. The alveolar wall is primarily formed by type 1 pneumatocyte and type 2 pneumatocyte. Type 1 pneumatocyte is a thin, flat cell that provide a short diffusion distance for oxygen and the carbon dioxide, while the type 2 pneumatocyte are fewer in number but are essential because they secrete the pulmonary surfactant. Surfactant is used to reduce the surface tension within the alveoli, to preventing collapse during exhalation and reducing the effort required for breathing. Surrounding the alveolus is surrounded by what? By a dense network of capillary forming forming the alveoli capillary, or known as the respiratory membranes, which allow the gases exchange. Across this thin membrane, the oxygen diffuses from the alveoli into the blood, while carbon dioxide diffuses from the blood into the alveoli to be exhaled. This highly specialized microstructure ensure the efficient oxygenation of blood and removal of metabolic waste gas, which is the carbon dioxide. Okay. Now let's get into the physiology of breathing. As we all know, breathing is a mechanical process that enables the ventilation and support gases exchange in the lung. Okay. During inhalation, our diaphragm, which is located at the inferior inferior position below, which is the below the lung, will contract and cause it become flatten. Okay. And the external intercostal muscle also will contract and cause the rate to elevate. When the external intercostal muscle contract, the internal intercostal muscle will relax. It is in opposite one. Okay. After the elevate of rate, this will increase the volume of the thoracic cavity, and increase thoracic cavity will lower the intrathoracic pressure and allow the air to move into our lung. It is because the atmosphere pressure is higher than the thoracic intrathoracic pressure, so it will force the air to push in or pull in into our lung. Once the air reaches the alveoli, the oxygen will diffuse into pulmonary capillary and bind to our hemoglobin for transport to tissue. And the carbon dioxide, a metallic Western product, is transported mainly as the bicarbonate ion and diffuse from the blood into the alveoli to be exhaled. This is this is the exhalation process. Exhalation process is the diaphragm relax and become curved, and the external intercostal muscle relax and the intercostal muscle contract and cause the thoracic cavity decrease decrease and the pressure increase and push the carbon dioxide out. Okay. The rate and depth of the breathing are regulated by what? By the respiratory system in the brainstream, particularly the medulla oblongata and the pons. This center respond to change in carbon dioxide and the blood pressure and the blood pH, ensuring adequate oxygen delivery and maintenance of respiratory homeostasis. How it regulate the blood pH? Uh, since we know that carbon dioxide is transported mainly as the bicarbonate ion, which is the acidic one. So when the carbon dioxide increase, the blood pH will increase, it will decrease to become more acidic, and this will stimulate the respiratory center to to increase the to increase the heart rate and the exhalation rate. Okay, now I would like to talk about the clinical relevance, and here the TB is one of the disease one of the major infection disease of the lung, caused by this TB is caused by what? The myobacteria tuberculosis, and is transmitted through the airborne droplet. Once the human inhale, the bacteria can reach the alveoli and multiply and trigger the inflammation, and leading to what? Leading to tissue damage and reduced gases exchange. And TB, the common system for the TB is include what? Persistent cough, chest pain, fever, night sweat, and weight loss. If if we not treat it immediately, the TB can spread beyond the lung and cause serious complication. The early diagnosis and effective antibiotic treatment are essential to prevent the disease progression and transmission. Advances in medical technology such as the artificial intelligence AI assistant chest imaging and digital diagnostic tools have improved the accuracy and speed of TB detection. So, I will conclude now. In conclusion, the lung play a vital role in respiration, oxygen delivery, and acid-base balance. By understanding this structure, function, and related disease is crucial for our human to maintaining respiratory health and improving the patient outcome. Okay, that's all from me. Thank you.